What is the prognosis for malignant primary cardiac tumors? Option 1. Good. Option 2. Fair. Option 3. Poor. Option 4. Excellent. The answer is option 3. Poor. What is the most common symptom of secondary cardiac tumors? Option 1. Chest pain. Option 2. Arrhythmia. Option 3. Pericardial effusion. Option 4. Dyspnea. The answer is option 4. Dyspnea. Which imaging modality is preferred for staging secondary cardiac tumors? Option 1. Echocardiography. Option 2. MRI. Option 3. CT scan. Option 4. PET scan. The answer is option 4. PET scan. Which cardiac tumor arises from adipose tissue? Option 1. Lipoma. Option 2. Fibroma. Option 3. Myxoma. Option 4. Angiosarcoma. The answer is option 1. Lipoma. Which condition is not commonly associated with cardiac tumors? Option 1. Atrial septal defect. Option 2. Embolic stroke. Option 3. Arrhythmia. Option 4. Heart failure. The answer is option 1. Atrial septal defect. What is the role of biopsy in diagnosing cardiac tumors? Option 1. Always required. Option 2. Often avoided due to risk. Option 3. Used only for secondary tumors. Option 4. Mandatory for surgical planning. The answer is option 2. Often avoided due to risk. What is the main pathological process in atherosclerosis? Option 1. Inflammation of the arterial wall. Option 2. Calcification of arteries. Option 3. Formation of blood clots. Option 4. Vasodilation. The answer is option 1. Inflammation of the arterial wall. Which is the most common site of atherosclerotic plaque formation? Option 1. Arterioles. Option 2. Large and medium-sized arteries. Option 3. Capillaries. Option 4. Veins. The answer is option 2. Large and medium-sized arteries. Which of the following is a major modifiable risk factor for atherosclerosis? Option 1. Age. Option 2. Genetics. Option 3. Smoking. Option 4. Gender. The answer is option 3. Smoking. What is a common symptom of peripheral artery disease? Option 1. Chest pain. Option 2. Intermittent claudication. Option 3. Abdominal pain. Option 4. Dyspnea. The answer is option 2. Intermittent claudication. What is the most feared complication of an aortic aneurysm? Option 1. Rupture. Option 2. Infection. Option 3. Vasospasm. Option 4. Calcification. The answer is option 1. Rupture. Which imaging modality is most commonly used to detect an abdominal aortic aneurysm? Option 1. MRI. Option 2. CT scan. Option 3. Ultrasound. Option 4. Chest X-ray. The answer is option 3. Ultrasound. What is the hallmark of deep vein thrombosis? Option 1. Pale, cold extremities. Option 2. Swelling and pain in the affected limb. Option 3. Rapid heartbeat. Option 4. Red, hot extremities. The answer is option 2. Swelling and pain in the affected limb. Which condition predisposes to venous thromboembolism? Option 1. Atrial fibrillation. Option 2. Varicose veins. Option 3. Immobility. Option 4. All of the above. The answer is option 4. All of the above. Which is the first-line treatment for deep vein thrombosis? Option 1. Antiplatelet therapy. Option 2. Anticoagulation. Option 3. Surgery. Option 4. Thrombolysis. The answer is option 2. Anticoagulation. Which artery is commonly affected in peripheral artery disease? Option 1. Carotid artery. Option 2. Femoral artery. Option 3. Radial artery. Option 4. Pulmonary artery. The answer is option 2. Femoral artery. Which is the primary goal in managing atherosclerosis? Option 1. Plaque removal. Option 2. Reducing LDL cholesterol. Option 3. Preventing infections. Option 4. Increasing HDL cholesterol. The answer is option 2. Reducing LDL cholesterol. Which symptom is not typically associated with atherosclerosis? Option 1. Chest pain. Option 2. Claudication. Option 3. Headache. Option 4. Stroke symptoms. The answer is option 3. Headache. Which is the main component of an atherosclerotic plaque? Option 1. Smooth muscle cells. Option 2. Lipid core. Option 3. Calcified matrix. Option 4. Collagen. The answer is option 2. Lipid core. Which is the common treatment for a ruptured aortic aneurysm? Option 1. Antibiotics. Option 2. Surgical repair. Option 3. Anticoagulation. Option 4. Observation. The answer is option 2. Surgical repair. Which test is most commonly used to diagnose deep vein thrombosis? Option 1. D-dimer test. Option 2. Echocardiography. Option 3. CT angiography. Option 4. Venous ultrasound. The answer is option 4. Venous ultrasound. Which is the most common cause of arterial aneurysms? Option 1. Atherosclerosis. Option 2. Trauma. Option 3. Infection. Option 4. Congenital defects. The answer is option 1. Atherosclerosis. Which is Virchow's triad? Option 1. Factors contributing to aneurysm formation. Option 2. Components of an atherosclerotic plaque. Option 3. Factors predisposing to thrombus formation. Option 4. Stages of peripheral artery disease. The answer is option 3. Factors predisposing to thrombus formation. Which lifestyle modification is critical in managing peripheral artery disease? Option 1. Avoiding exercise. Option 2. Reducing dietary salt. Option 3. Smoking cessation. Option 4. Weight gain. The answer is option 3. Smoking cessation. Which is the usual presentation of chronic venous insufficiency? Option 1. Pitting edema. Option 2. Skin discoloration. Option 3. Leg ulcers. Option 4. All of the above. The answer is option 4. All of the above. Convert text to speech, English to Tamil, Tamil to English. Do you need high-quality text-to-speech conversion? We provide clear, natural voice-overs for your needs. English to Tamil and Tamil to English. Professional audiobook creation. Drop your queries in the comments. Have a requirement? Message us now. Let's bring your words to life. What is a non-invasive treatment option for venous thromboembolism? Option 1. Compression stockings. Option 2. Catheter-directed thrombolysis. Option 3. Anticoagulants. Option 4. Inferior vena cava filter. The answer is Option 1. Compression stockings. Which type of aneurysm is associated with infection? Option 1. Fusiform. Option 2. Mycotic. Option 3. Saccular. Option 4. Dissecting. The answer is Option 2. Mycotic. What is the role of exercise in peripheral artery disease? Option 1. Worsens claudication. Option 2. Improves circulation. Option 3. No role in management. Option 4. Only for severe cases. The answer is Option 2. Improves circulation. Which pharmacological treatment is commonly used in venous thromboembolism? Option 1. Aspirin. Option 2. Warfarin. Option 3. Statins. Option 4. Beta blockers. The answer is Option 2. Warfarin. Which layer of the artery is primarily affected in atherosclerosis? Option 1. Adventitia. Option 2. Media. Option 3. Intima. Option 4. Endothelium. The answer is Option 3. Intima. Which diagnostic test is used to assess ankle brachial index in peripheral artery disease? Option 1. Ultrasound. Option 2. Doppler test. Option 3. CT angiography. Option 4. X-ray. The answer is Option 2. Doppler test. What is the primary indication for coronary artery bypass grafting? CABG. Option 1. Severe heart failure. Option 2. Blocked coronary arteries. Option 3. Aortic aneurysm. Option 4. Cardiac arrhythmia. The answer is Option 2. Blocked coronary arteries. Which vein is commonly used for grafting in CABG? Option 1. Femoral vein. Option 2. Saphenous vein. Option 3. Jugular vein. Option 4. Subclavian vein. The answer is Option 2. Saphenous vein. What is the purpose of valve replacement surgery? Option 1. To repair coronary arteries. Option 2. To replace diseased heart valves. Option 3. To close a ventricular septal defect. Option 4. To prevent arrhythmias. The answer is Option 2. To replace diseased heart valves. Which imaging technique is most commonly used to plan cardiothoracic surgery? Option 1. MRI. Option 2. CT scan. Option 3. Echocardiography. Option 4. X-ray. The answer is Option 3. Echocardiography. What is a common complication after cardiothoracic surgery? Option 1. Pulmonary embolism. Option 2. Hypotension. Option 3. Atelectasis. Option 4. All of the above. The answer is Option 4. All of the above. Which condition is a key indication for mitral valve repair? Option 1. Aortic stenosis. Option 2. Mitral regurgitation. Option 3. Ventricular fibrillation. Option 4. Pulmonary hypertension. The answer is Option 2. Mitral regurgitation. Which cardiothoracic procedure is commonly performed to treat atrial septal defects? Option 1. Valve replacement. Option 2. Bypass surgery. Option 3. Surgical patch closure. Option 4. Heart transplantation. The answer is option 3. Surgical patch closure. What is the role of cardiopulmonary bypass during surgery? Option 1. To remove blood clots. Option 2. To maintain circulation and oxygenation. Option 3. To measure cardiac output. Option 4. To prevent arrhythmias. The answer is option 2. To maintain circulation and oxygenation. Which of the following is a minimally invasive cardiothoracic procedure? Option 1. Open heart surgery. Option 2. Transcatheter aortic valve replacement. TAVR. Option 3. Coronary artery bypass grafting. CABG. Option 4. Heart transplant. The answer is option 2. Transcatheter aortic valve replacement, TAVR. What is the first step in postoperative care after cardiothoracic surgery? Option 1. Administering antibiotics. Option 2. Monitoring vital signs. Option 3. Removing surgical drains. Option 4. Encouraging physical activity. The answer is option 2. Monitoring vital signs. Which heart valve is most commonly affected in valve replacement surgery? Option 1. Aortic valve. Option 2. Mitral valve. Option 3. Tricuspid valve. Option 4. Pulmonary valve. The answer is option 1. Aortic valve. What is the primary goal of heart transplantation? Option 1. To cure coronary artery disease. Option 2. To replace a failing heart. Option 3. To improve arrhythmias. Option 4. To prevent myocardial infarction. The answer is option 2. To replace a failing heart. Which medication is crucial in postoperative care to prevent graft rejection after heart transplantation? Option 1. Antibiotics. Option 2. Anticoagulants. Option 3. Immunosuppressants. Option 4. Beta blockers. The answer is option 3. Immunosuppressants. Which condition often requires emergency cardiothoracic surgery? Option 1. Atrial fibrillation. Option 2. Acute aortic dissection. Option 3. Chronic heart failure. Option 4. Mitral valve prolapse. The answer is option 2. Acute aortic dissection. What is a common symptom that indicates the need for cardiothoracic surgery? Option 1. Shortness of breath. Option 2. Chest pain. Option 3. Fatigue. Option 4. All of the above. The answer is option 4. All of the above. Which diagnostic test is most helpful before coronary artery bypass surgery? Option 1. ECG. Option 2. Echocardiogram. Option 3. Coronary angiography. Option 4. CT scan. The answer is option 3. Coronary angiography. Which type of valve is used in mechanical valve replacement? Option 1. Biological valve. Option 2. Metallic valve. Option 3. Synthetic polymer valve. Option 4. Donor heart valve. The answer is option 2. Metallic valve. Which lifestyle modification is critical after cardiothoracic surgery? Option 1. Quitting smoking. Option 2. Increasing salt intake. Option 3. Avoiding exercise. Option 4. Prolonged bed rest. The answer is Option 1. Quitting smoking. What is the primary advantage of minimally invasive cardiac surgery? Option 1. Lower cost. Option 2. Faster recovery time. Option 3. No need for anesthesia. Option 4. No surgical risk. The answer is Option 2. Faster recovery time. Convert text to speech, English to Tamil, Tamil to English. Do you need high-quality text-to-speech conversion? We provide clear, natural voice-overs for your needs. English to Tamil and Tamil to English. Professional audiobook creation. Drop your queries in the comments. Have a requirement? Message us now. Let's bring your words to life.